Let me introduce myself. I am Dr. Herbert Rappaport, recently retired from a busy career as a board-certified internist and medical oncologist. In my 40-plus years of practice, I have seen far too many people who were suddenly faced with a critical illness and were at a total loss, feeling helpless and very confused. From my unique position, I have started a patient advocacy practice, using my experience, skills, and contacts to help people in need one at a time. I do not act as the patient's physician, rather as a knowledgeable advocate who analyzes the patient's medical history and current status, then personally reviews all X-rays, imaging studies, and biopsies in order to get an in-depth understanding of the entire situation. Then, I will help guide and direct the patient to receive the most appropriate state-of-the-art treatment. In addition, I will be able to pursue and facilitate access to promising academic clinical trials and make arrangements for compassionate use of still experimental drugs or treatments if such are indicated. Now, I would like you to take a minute to hear from one of the people whom I have successfully guided through a critical illness.
I want to relate a brief story about how my life was saved. About 7 or 8 years ago, severe stomach pain and gastrointestinal bleeding led to the discovery of a cancerous growth in my intestine. It was surgically removed, and I was absolutely healthy and feeling well until 3 months ago. Then, after being evaluated for recurrent stomach pain and for loss of appetite, studies showed that the tumor had grown back massively. Over 1/2 of my abdominal cavity had been taken over by a cancerous growth. My oncologist prescribed medication for me that is almost uniformly effective in treating this type of recurrent cancer. However, I got sicker and sicker, despite switching to another cancer-fighting medication. I had to be hospitalized twice in 1 month. I was in severe pain. I had to have many blood transfusions. I was getting weaker. I was losing weight. I was hallucinating, and I was losing hope. My doctors didn't know what to do in order to help me. No one came up with any alternative plan in this seemingly losing battle. My family and I believed I was dying. So did my doctors. Then, I consulted Dr. Herbert Rappaport, an experienced oncologist who had recently retired from a busy full-time practice and who was now pursuing an innovative part-time career as a patient advocate. He carefully analyzed my situation. He reviewed the imaging data, and after summarizing all this data and presenting it to a board of 50 members convened as a tumor board, convinced me and my family and a leading cancer surgeon that the only way out of this medical tailspin was to surgically remove the bulk of the tumor. Now, this procedure is almost always frowned on because it's almost always futile. However, my type of cancer, a sarcoma, often behaves differently. No one else had realized this, nor had anyone else even suggested the possibility of a surgical approach. Dr. Rappaport was thinking outside the box. Then, after a 5-hour surgery, 95% of the tumor was removed, and I slowly but steadily recovered. I began to gain weight and feel well. I've gone back to work full time. I take one pill each day, which has the potential of preventing the regrowth of the tumor. If you have a life-threatening medical problem, especially cancer, an experienced, independent advocate could be just the expert to turn things around, or at the very least, reassure you and your family that no stone has been left unturned in the pursuit of finding the right path to follow. Dr. Rappaport is uniquely qualified to assist you in this endeavor. Now, I expect that often he will reinforce that the optimum treatment has been implemented, but he may also think of other potential ideas or treatments for consideration, possibilities that may not have been proposed by your current medical team. Or he may propose a game changer, one that could favorably alter your prognosis. He can also help your doctors and you by devoting the time to explain to you and your family in pertinent detail the characteristics of your particular disease, explore different pathways and different innovative procedures, and also warn against potential side effects and how best to minimize or avoid them. He is available 24/7 and is devoted to helping at most 4 or 5 patients at any one time. His expertise can be invaluable in guiding you through the often torturous and confusing maze of medical treatment for life-threatening diseases.